Dr. Gaeta received her medical degree from the University of Maryland and completed internship and residency at Boston Medical Center. She served as chief resident of internal medicine in 2001. Dr. Gaeta cares for homeless people in Boston. Her patients live in poverty, despair, and some on the brink of death. In 2009, she was named the medical director for McGinnis House, a 104-bed medical hospital that provides 24-hour medical care for homeless people. She also co-founded Home and Healthy for Good, a program with the mission to first find permanent housing for chronic homelessness and then to treat their illnesses. This organization has now provided housing for many chronic homeless people, but has also saved the state thousands of dollars in hospital and emergency bills per patient. Of the 400 patients in the program, 86% continue to maintain their residence. The program has been so successful that the state has doubled the $1.2 million it has for funding the program. Dr. Gaeta.
Thank you, Dean Antman, Dean Hyman, distinguished faculty, mentors, graduates, families, friends, and guests. The opportunity to address you on this graduation day is a tremendous honor, and I'm so fortunate to stand before you today in this stylish hat and look out at your faces as you prepare to cross this monumental threshold. One of my strongest connections to this class is through the Boston University Advocacy Training Program, and I'd like to dedicate this speech to the students here who have crafted and sustained that curriculum. When I consider what this career has meant to me since my own graduation from medical school, I am filled with marvelous hope and excitement for you. Yet all of us are aware of the unprecedented challenges facing our profession: dramatic uncertainty in the face of reform, soaring costs, the desperate need for improved quality of care, and the need for universal access to care to be considered a human right. But despite these pressures, I remain convinced that this work of healing, bearing witness, seeking to understand disease and all its devastating manifestations, at its essence, the work of relieving suffering, is a most gratifying and magical life's work. As you take an ancient and sacred oath today, and as you don your white coats and stethoscopes with new accountability, let's first take note of the vast privilege and power that society will grant you after you walk across this stage. I'm certain you've already begun to experience it, but it will unfold much more clearly in the months and years to come. You will be considered an expert on all things remotely scientific and in all things deriving from human nature. Your opinion will carry great weight in the exam room, on an airplane, at your neighbor's dinner table or your daughter's soccer practice, on the written page, in the corner office of the State House, on the street corner, or even at the podium. You have the privilege of hearing your patients' deepest secrets, insecurities, and fears, and you have the power to do something about those fears, if only to validate them at times. You have the privilege of going just about any place on earth and offering your services to the people who live there. And if you're lucky, you might actually have the power to help them through health education, clinical care, well-designed research on the injustices of poverty, or simply by bearing witness to their suffering and using your powerful voice to advocate for change when they cannot. I'm still in awe of the privilege and power we are afforded, even though many years have passed since I sat where you are sitting today. And knowing you as I do, I know you'll use that privilege and power in the best possible way. But before I congratulate you on completing your graduate work, and with it, gaining status that few others in society have, let's talk about the other side of that equation. What we owe society in return, what society needs of you. Scientist or clinician, let's focus on what it really means to be a healer. When we are asked what we do, we nearly universally reply to that question using a different verb than the one in which the sentence is framed. We do not say, I do doctoring, or I do science, or even I work as a doctor. Those sentences sound almost ridiculous. We reply to this common question rather using a form of the verb to be. I am a scientist. I am a doctor, we say. And this is true for many other professions as well. But for us, the constancy and permanence implied in the way that we state our vocation is instructive. In other words, sometimes despite enormous pressures on us to do something medical or do something scientific for our patients, it is the simple fact that you are a healer, that you are a doctor, that makes the most difference. To illustrate this point, let me introduce you to a patient. I'll call her Lisa. She's not only my patient, she's your patient too. A handful of you in this room have cared for her on the inpatient wards at Boston Medical Center. A nurse and I first met Lisa in an exam room the size of a closet in a small homeless shelter south of Boston. She was 58 years old at the time, single, uneducated, and homeless for the second time in her life. Lisa had been adopted at a young age, and she grew up on the South Shore in a family with little money or means. Working in a factory as a young adult, she suffered an industrial accident that resulted in the loss of part of her right hand. And although she held various jobs after that, she was never paid more than minimum wage and could never afford to live independently of her adopted parents, even well into adulthood. Hey, Dr. Gaeta, she would often greet me as I became her primary care physician. She was hospitalized several times that first year in the shelter, always for exacerbations of her emphysema. Lisa had been a chain smoker since the age of 16, a trait she shares with most people who experience homelessness. But it wasn't until she stayed in shelter that her lungs really began to fail. She suffered respiratory infection after infection, and she was always short of breath and palpably anxious. As I grew to know her, I became aware of the many reasons that she might be so anxious. She suffered from extreme poverty. She always had to wonder where her next meal was coming from, and she had to find a way to afford the co-pays for her inhalers. She was alone, without family, and that reminded her of her painful childhood. She was sleeping in a shelter with 90 strangers each night, most of them men, and I always seemed to sense her fear around men, although she never did explain to me why she was fearful. She was unhealthy in many ways, not the least of which was her lack of meaningful connection to people around her whom she could trust. The nurse and I hoped there was something therapeutic in our relationship with Lisa, even if we couldn't seem to manage her chronic illnesses. Everything we tried to do for her medically, help her quit smoking, prescribe medications for her lung disease and anxiety, provide screening tests and appropriate referrals, none of it could overcome her social and economic situation. Her chronic conditions did nothing but worsen, and at times it seemed as though she held on to her cigarette as if it were her last friend on earth. We practiced damage control medicine. We barely had time between hospitalizations to think about preventive care, and we were woefully behind in screening for her for cancers. Despite this, and the fact that I was very worried about her future and my ability to impact it, we built a trusting relationship over numerous visits in that tiny room in the shelter. Frustrated, as you will be at times in your career, and feeling powerless to measurably impact Lisa's health, I began to imagine, what would it actually take? Deep down, I knew that Lisa needed the safety and stability of a home if she was going to thrive after the death of her parents, begin to address her addiction to tobacco, avoid oxygen therapy, cope with her prior traumas, and defy the premature mortality associated with a lifetime of poverty and months of homelessness. Housing was always her self-management goal, and eventually I came to see it as the most important prescription I could write for her. But how could I, from our tiny exam room, help her secure housing? I'll tell you how. I started working with the shelter administration to prioritize her for housing. I made the medical case for it. I recounted her expensive hospital stays. I attested that she would indeed be safe in housing. And with her permission, I described the ways her health would improve. I began to advocate for one of the most basic survival needs, safe and secure housing. I'll always remember her move into a modest double-decker in Quincy, made possible by the shelter with a federal housing voucher and some support from the state. Our team, the nurse and I, made several home visits. She was so proud to show us the plant she had cared for and to introduce us to her neighbors. I had never seen her smile before. In the months after settling in and regaining her footing, her emphysema stayed at bay. Her confidence increased, and we were finally able to accomplish some preventive care, including a pap smear. And that was no small feat. I now understand it took a significant amount of bravery on her part to allow that difficult examination. It was immediately clear that she had cancer. In fact, the tumor was so large, Lisa must have known it had been there for years. The sight of it literally took my breath away. I was heartbroken that it had taken her so long to be able to disclose this pathology deep inside, and I wondered what other demons she secretly harbored. I swallowed hard. I tried to hide my astonishment and worry, and when our eyes met, I simply said, "Lisa, we're going to take care of this together." Indeed, it was invasive squamous cell carcinoma, and it was extensive. I brought her to Boston Medical Center for a complex pelvic surgery, and the entire tumor was removed successfully. In the weeks that followed in the hospital, she suffered the necessary indignity of daily pelvic exams and the care of deep wounds in the most private of places, performed by doctors, nurses, students, you, who intuitively knew how to care, how difficult that care was to endure. She had no family to support her, and I was her only visitor. And I was never so proud of this institution and its students, and this hospital and its caregivers, as when Lisa thanked me for bringing her here and wept with gratitude. To think that we cured her cancer and managed to make this damaged woman who had been through unspeakable life events feel dignified in the process. That Lisa did not have to return to the chaos of the shelter with her drains and catheters, particularly in those first few weeks following her surgery, seemed a godsend. Indeed, it felt miraculous that she was discharged home, cancer-free, and with a newfound confidence. Years later, she continues to thrive at home and has not been hospitalized since her surgery. She's developed hobbies and a community of friends. In fact, she sometimes comes with me to tell her own story and to testify to policymakers that our resources for chronically homeless people who suffer the most extreme poverty and an unparalleled burden of illness should be spent, above all else, on supportive housing. She explains better than I ever could the impact of that housing on her health. With Lisa's help, we have since appropriated enough resources in the state budget to provide supportive housing to more than 700 chronically homeless people across Massachusetts. And with your efforts over the coming years, I am certain that number will continue to grow. I relate this case to you because it was special to me. It was a turning point, really, in my career. Lisa taught me a number of things. I learned that in order to help relieve suffering, I needed to build a trusting relationship. And that was the foundation for everything that followed. This is the most important secret of the trade that I can pass on to you. Relationship is everything. Your relationship with the patient is the basis of all healing. And even when everything else fails, you can fall back on that relationship, on that connection with your patient. It is inherently therapeutic, and it will heal, but it is not enough. There are times when the doing implied in providing care will leave you wanting at the bedside because there is no cure, or because there is a cure, but it is no match for the despair of the living conditions of the patient, or because no medicine will ease the suffering of the patient, and yet you still have something healing to offer your patient. The fact that you are their doctor and the constancy of your relationship with them gives them a connection, a validation, and support that they might not have from anyone else. When our doctors are asked to describe us, they will not say, "She works as my doctor." Rather, your patients will say to you from this day forward, "She is my doctor." Scientists, we need you to cure the tobacco addiction and the emphysema. We need you to understand the impact of social and economic factors on health. We need you to let go of research for the sake of research. Behind the answers and truths you seek, be sure there is a suffering patient or population. Never lose sight of the fact that what you are doing in the lab translates directly to a suffering person, and let that guide you in your design and implementation of your research. Clinicians, we need you to imagine what it would take to change the course of disease for your patients. Healers, all of you, in order to improve the health of a patient or a population, in order to relieve suffering caused by disease, you must look beyond the biomedical model. You must recognize the structural inequities that influence health. Make it your explicit goal to diagnose these underlying conditions that result in poor health, and then ask yourself, how can I, with privilege and power, impact those underlying factors? You see, I know each and every one of you, whether we've personally met or not. I know your training, your education, your integrity. I know of your tremendous hope for yourselves, your profession, and your patients. You do have the skills to influence change. You do it all the time already, as you influence your patient to take a medication, as you convince a colleague to consider a certain diagnosis, as you make a call on behalf of your patient to their landlord, as you insist the MRI is done tonight, as you make the case for funding a research project and a grant proposal, or persuade your PI to consider a variable that no one else has considered. You do it as you meticulously study the model of end-of-life care in a dying patient at the Barbara McGinnis House. Now go one step further. Take advantage of your special status and credibility and look to affect the underlying root causes of poor health for one patient or one population. Ask yourself, how can I design the study so that it answers the question not only for the obvious and typical research subjects, but for people living in the shadows? How can I make this surgical technique available to the people who need it most? What would it really take to change the course of disease? All of you can answer these questions in any practice, with any group of patients, in the lab researching the workings of any disease. First, remember the foundation. Relationship is everything. Then take a small step and perhaps eventually a leap out of the comfort zone of your clinical and scientific knowledge base. Bear witness to injustices that result in poor health and work to remove those injustices and build health equity. This is what healers owe society. And this is what our society desperately needs at this point in time. Take your excellent knowledge base from Boston University and use your own caring human awareness to heal your patient and build health equity. Don't forget to thank your families, your friends, your mentors, and your classmates for helping you reach this tremendous milestone, this grand beginning of your medical careers. You are now doctors. Congratulations, class of 2013. Because of you, I have hope for our great profession.